Good day, my name is Imelda Williams. This presentation will focus on common brain pathology. Now, normally with the CT image interpretation, the main focus is on trauma as well as stroke conditions. However, sometimes you will come across some incidental findings which are important and which you should be able to recognize. So at the end of this lecture, I hope you will have gained some understanding of the various types of common brain tumors, the imaging appearances of infections in the brain, as well as the appearance of arteriovenous malformations. And here I've given you some of the resources again, and of course you will have electronic access to Ottochan's Chapter 8, which is focusing on CT of the head. I've included a slide, and I thought it would be useful for you just to know some of the normal values. Remember, when you scan a patient, you can do a region of interest, or ROI, and then use the Hounsfield units to determine, for example, whether you're looking at blood, which is around about 40 Hounsfield units, or whether you're looking at brain tissue, for example, white matter, which is higher, which is around 46, and whether you're looking at a cerebrospinal fluid, which is has a Hounsfield unit of about 15. The important thing to remember is that the adult skull is a closed box, and therefore when there's an increase in intracranial pressure, this can cause, for example, edema, and intracranial hemorrhage can then act also as a mass. So when there's an increase in intracranial pressure, and this could be also due to tumors or infections, if that is not relieved, the consequences can be very severe for the patient, because you could find herniation. Remember what we talked about, a part of the brain moving to another part because of increased pressure, or there could be infarction, or it could in the end result into death of the patient. Now, looking at the ventricular system, when we see enlargement of the ventricular system, it actually shows that there is something causing the hydrocephalus. So as patients get older, hydrocephalus can be age-related, and this can also be found in some of the degenerative conditions such as Parkinson's and Alzheimer's disease. So hydrocephalus is almost like a symptom of an underlying pathology. It's important when we look at brain tumors to look at the main causes. So this is a description of some of the most common brain tumors, and you will note that for the adult patient, about 50% of brain tumors are attributed to metastases. However, when we compare this to the pediatric patients, you will note that the biggest percentage is due to astrocytomas, for example, pilocytic astrocytomas. And when we look at metastases, that makes up a very small percentage of brain tumors with pediatric patients. Now, when patients experience a tumor of the brain, they could present with different types of symptoms. And some of these symptoms could mimic other types of neurological disorders. If you have an adult patient who has never had seizures before and has a new seizure, then the first differential diagnosis is whether there is a tumor. Also, when a patient experiences progressive neurological deficit or gradual loss of movement or sensation in an arm or a leg, and if they become unsteady or there's imbalance, and especially if the patient complains with severe headaches. These are all symptoms that could indicate the possibility of a tumor. In addition, convulsion, loss of vision in either one or both of the eyes, and especially if there's peripheral loss of vision, or if a patient has double vision, and again if it's associated with headaches, and if a patient starts to complain of hearing loss, and this could be with or without dizziness. And then sometimes over time the patient might have difficulty with speech, so it's of a gradual onset. And then especially if a patient complains of persistent headaches, and this is associated with nausea, vomiting, double vision, numbness or weakness. And sometimes family are able to detect a change in behavior, and this could be a very subtle sign. Now this slide is quite useful because it indicates, again, just as a refresher, which parts of the lobes of the brain is responsible for, example, behavior, memory and so forth. So with the frontal lobe, you can see that intelligence and behavior is controlled from that part. The temporal lobe also involves behavior, but hearing, speech and vision. If you look at the parietal lobe, again here affects intelligence, the ability to read and language and sensation. The occipital lobe is primarily associated with vision. The cerebellum is responsible for balance and coordination. And then finally, the brain stem is really important because it controls blood pressure, breathing, consciousness, heartbeat, and swallowing. So because of the fact that the brain is enclosed in the skull, which is a closed box, both malignant and benign tumors can be fatal. Malignant metastases in the frontal lobe could be completely excised, so it depends on where metastases are, where the tumor is located. However, an increase in cerebrospinal fluid can also result in an increase in intracranial pressure. You will find that about 70% of brain tumors are above the tentorium cerebelli, whereas with children the majority is infratentorial. As mentioned in the previous slides, that adults mostly experience metastatic tumors to the brain, which is more common. So that arises elsewhere and then spreads to the brain via blood. And quite often the metastases would be multiple. The tumors that commonly metastasize to the brain include tumors from the lung, the large bowel, and the breast. So in determining the prognosis for a patient, so the first thing is to locate where the tumor is, and because it will depend whether the tumor can be excised or the metastasis can be excised, and also the number of metastases, the grade and type of a tumor. Also, if there's a primary tumor in the brain, for example, is to spread into other areas of the body. So the main key thing is, can the tumor be removed surgically? And then the response to therapy, medical conditions, and then if the patient is experiencing any other complications. So giving contrast is quite important. So on the slide on the left side, you can quickly note that it looks like there's 2 metastases. However, after giving contrast, you can now note that there's definitely 3 sites of metastases, as they have taken up the contrast quite well. So it's really important if metastases is queried that the patient is given contrast. Now, moving on to primary tumors, gliomas makes up about 50% of the adult brain tumors, and these are more common in the cerebrum of adults and in the posterior fossa in children. Gliomas have a tendency to increase in grade, so it becomes worse over time. They may be multifocal. Now, gliomas are differentiated according to the cell of origin. For example, if the origin is an astrocyte, the tumor will be called an astrocytoma. If the origin, for example, is a medulloblast, the tumor is a medulloblastoma. And again, here on this image, we can see the area where there's a tumor, and then also after contrast, how bright it becomes. But do also note that around the tumor itself, there's a large area of the brain that's been affected by edema of the brain. An MRI is quite useful, especially if you want to determine how big the area of the brain has been affected by edema. So here we can see the tumor itself. However, on the image on the right, we can see that a much larger area has been affected by edema. Medulloblastoma is a tumor that is found in the cerebellum, and it's more common in children. The highest incidence in terms of age is around about 2 to 7 years. Unfortunately, this is a very fast-growing tumor. It's also the most common brain tumor in children. It also spreads via CSF, so it will spread from the brain and into the spinal cord. This tumor can also occur in adults. Some of the first signs of a medulloblastoma is the fact that it affects the movement and coordination. So patients might present with signs of headaches and vomiting and ataxia. So ataxia is where the movement has been affected because of muscular problems with coordination. The tumor is usually found in the cerebellum or the vermis, and if contrast is given, the tumor will enhance very well. And here we have a scan, and you can see there's a large tumor in the post fossa. And then unfortunately on the same patient, we have a post-mortem slice, and it shows the big tumor in the post fossa, and that it has actually gone down the brain stem. The next common tumor to consider is a meningioma. It makes up about 15 to 20% of primary brain tumors. These tumors are usually benign. It arises from the meninges of the brain, and it can also arise from the spinal cord. Meningiomas are more common in middle-aged adults and especially in women. So we're looking at later adulthood. So as I said, there's a bigger preponderance amongst females. It's a tumor that enhances very well, and normally it's quite well defined. And although the tumor looks quite big, because of its position, it can most of the times be easily excised. Okay, so now moving from tumors to infections. So infections to the brain can result from blood septicemia or from a local spread, and this can give rise to meningitis or abscesses. So here we have scans of a patient who was 8 years old and who had sinusitis. And this resulted in cerebritis. So you can see on the scan on the right that the sulci is very bright, so it takes up the contrast. And then you can also see on the right side that there is a subdural empyema. And the reason why we see that is that when you give contrast, the contrast doesn't cross over, so the blood-brain barrier then highlights the area that has the empyema. It's important to note with sinusitis, if we think of the position of the sinuses, frontal sinuses, which is very close to the skull of the brain. So if there is severe infection and it breaches the bony skull, then it will go directly into the brain, and then also sphenoid sinuses. So those infections should be closely monitored. And here we have another scan, and this is an infection with a patient who has herpes simplex encephalitis. And you can see on the middle scan that we've lost the gray-white matter differentiation. We can also see on the MRI scan, especially on the right side, the big area that's been affected, and it's because of the fluid within that area. Another type of infection is neurocysticercosis. So it's a parasitic type of infection, and the main cause is that of a tapeworm, which is found in uncooked pork. So in the scans at the bottom, you can see this numerous little punctate highlighted areas, so small low densities, and when contrast is given, that will increase. So you could either see low densities in the early stages, and then also they can become cystic, and then if contrast is given, they will show up as ring enhancement. Calcifications with neurocysticercosis is quite common. The larva fails to complete the life cycle and eventually dies. Now, in terms of infection, really important to be able to differentiate a brain abscess. So the main causes for a brain abscess is either a sinus or mastoid origin, and abscess is basically a collection of pus within the brain. Now, as mentioned before, the brain forms a blood-brain barrier around the area of the pus because it tries to protect itself. So when contrast is given, you will see a very smooth ring enhancing around the abscess. So really important to give contrast. And again, if we look at the scan, especially at the bottom, we can see that there's also an area being affected by edema. TB, which is caused by mycobacterium, can also affect the cerebral neurovascular system apart from the lungs. So basically, when there is a resurgence of TB, and especially patients that are vulnerable are patients who has HIV/AIDS or patients who uses drugs, which means there's an opportunity for opportunistic infection to spread. So in the brain, some of the infections that will occur is either basilar meningitis. You could have tuberculomas, and these could be parenchymal or in the supratentorial region. If there's a tuberculoma, if contrast is given, there will either be a solid or a ring enhancing. They are more common in the posterior fossa. Here we have slides for a 9-year-old who had multiple abscesses, and you can see the patient has been given contrast, and you have enhancement of the meninges as well. So meningitis, purulent meningitis. So purulent means pus-forming type of meningitis, so that the cause normally is from sinusitis. It's useful to note that a non-enhancing CT scan can often be normal. So you need to do a contrast-enhanced CT scan, and this will show meningeal enhancement over the frontal, parietal, and interhemispheric fissures, as well as the sylvian fissures, and then also obliteration of the basal cisterns with enhancement. So empyema is a located collection of pus, and that's in the subdural space, or it could be in the epidural space, or both. The appearance could be either hypodense to isodense, or isodense meaning that it has the same appearance of brain, and it could be extraaxial collection with rim enhancement. So again, contrast is important if infections is suspected. Some of the complications for patients could be venous thrombosis, or then the formation of a brain abscess. Okay, so the next thing we need to look at is arteriovenous malformations. These are masses of abnormal blood vessels. It's also called a nidus, and it's where you have direct connections and not having connections via the capillaries. So basically what you find is a large collection of malformed vessels. So the image on the left side here shows the arteries connecting to the veins via the capillaries in the middle. However, with an AVM, you can see that the arteries are connecting directly to the veins without having the capillary connections. So on a non-contrast scan, here we can see on the right-hand side, which looks like a collection of calcifications. However, that is a collection of an arteriovenous malformation. And then treatment for that is where we can see with the CT angiography, you can see the mass of AVM, and they would then actually occlude the vessel that supplies the AVM. So in summary, CT imaging of the brain quite often diagnoses incidental findings. It's therefore useful to have an insight in some of the common pathologies that affects the brain. In particular, a focus on identifying brain tumors, brain inflammation, as well as some of the other pathological conditions, apart from traumatic and stroke conditions. Thank you.